what is the cochlear implant process? At our center at Pacific Neuroscience Institute, we're really lucky that we have a lot of individuals here to help you through the process. We have a patient coordinator who will schedule all of your visits and guide you through each step of the way. We have a patient outreach support person who will come to some of these appointments, make sure that you're aware of all of the details of each visit. And then we also have a surgery scheduler who will help you with all of your insurance questions. So in the beginning of the process, you come in for your cochlear implant evaluation day. And that appointment is about 2 hours with me, the cochlear implant audiologist, to go over all the details about what a cochlear implant is, the benefits, the limitations, and then also to do some aided testing with hearing aids on to see if you are a candidate. We make sure the hearing aids are appropriately programmed so that we could tell if you would continue to benefit with hearing aids or if we think the next step would be a cochlear implant. After meeting with me, you would meet with Dr. Courtney Volker to go over surgical concerns, and she'll go into more detail about that. If we find that you're a candidate and you're ready to move forward with the process, you would come in for surgery. And after surgery, you get your kit, your cochlear implant backpack with all of your tools, your speech processor, your batteries, your accessories. And at that point, you get to go home, relax, heal, and at some point during that first week after surgery, we'd love for you to meet with the cochlear implant manufacturer to sort of start practicing using your batteries, opening your kit, getting familiar with the equipment. So when you see me about a week after the surgery to turn on the cochlear implant for the first time, you're a little bit more familiar with all of the equipment. Then you see me again 3 weeks later. And that's my favorite visit because that's when I really feel like I see patients getting used to the cochlear implant, the sound quality, and we can make a lot of good adjustments at that 3-week visit. People leave really happy. I see you another time at 3 months after the activation, or 3-month post-visit, and that's when most patients score really high in the test that we started out with at the evaluation. So on average, patients take about 3 months to see a huge improvement from the cochlear implant. Sometimes it takes a little bit less time, sometimes a little bit more, depending on a number of patient factors. And then after that, I might only see you once a year for an annual check-in. We also have devices with remote programming or ways to remotely check the device. So if it's hard to come in, we can even work with patients that way. Of course, this strategy where we see patients only 3 times in the first 3 months and then potentially annually works for about 80% of patients. So if someone needs to come in more or needs some adjustments, we're always here for you. But research demonstrates that we don't need patients to come in and have this be such an arduous part of their life. We can really optimize the cochlear implant in 3 months and then just monitor annually.